Restored Smiles helped me, of course, place implants. But more importantly, what it did for me, the class and being with Huss, was troubleshooting. It's placing an implant, I guess anybody can do, but knowing that I have to place an implant in the office without having an instructor looking behind my back, making sure I'm doing it right, that was the challenging part. And so I just troubleshooting. I think that was the biggest take, that I felt like, hey, if anything goes wrong, I know how to take care of it. And I think that's what built my confidence, wherein I didn't have to schedule time. I could do implants if I felt like the patient needs, and there's a time constraint, the patient can't come back. I knew how to take care if something went wrong. What I value the most is the support from Huss, especially the first few weeks. When I started to place implants on my own, I could call him, I could discuss a scan with him, he would guide me through. So knowing that I have a support I can call, and he was available to assist me with the planning if I needed his help, that was one of the biggest things. Because any other course, it was kind of, what I have learned was difficult for a lot of my colleagues to get, because they're part of a bigger group, and that personal relationship was not there with the instructor. I did feel a good amount of individual attention during the course and after the course. When we were placing implants, Huss was right there. If I needed Huss, I could call him and he would be right there with the patient when we were taking the classes. Obviously, as I said earlier, even after he was available to discuss anything that I wanted to discuss for planning for a patient before placing implant.
My name's Dr. Shogi Fareed. I'm based out of Central California. I'm a general dentist at Packwood Creek Dental Group in Visalia, California. Restored Smiles has given me the confidence to be able to provide treatments to my patients that I never thought I'd be comfortable providing on my own. I've been able to provide them dental implants, preserved bone for future prosthetics. It's something that I'd be usually referring out to our general our specialists, but now I'm able to provide in our own office. So I've become extremely confident in being able to provide services to our patients that typically wouldn't be able to be seen for a variety of reasons, whether it was too difficult for them to be able to be referred to an outside provider, or it's sometimes a lot easier just for them to get started in our office at the same time. When I took the Restored Smiles courses with Dr. Huss, I was able to belong to a community that I was always able to reach out to if I ever had any issues, or call Dr. Huss himself to be able to provide insights into any difficulties I may have or any advice that he might be able to provide for me. Dr. Huss provides a really great relationship for all the participants of his course before and after taking the course. So he starts out by providing fantastic clinical work. His phone number is readily available, so you can reach out to him, text message him whenever you need anything. And his assistant, Jesus, is just really fantastic and really is able to kind of provide you with the technical details you may always need. I'd recommend the Restored Smiles courses to anyone who's wanting to become more familiar and confident in their clinical surgical skills. So whether they're looking at surgical implants, grafting and regenerative treatments, it's the course that you want to take. I wouldn't look any further. You're able to provide you with services and confidence in being able to draw blood and provide growth factor treatment, placing implants, bone grafting, and extractions, and potentially sinus lifts too. After taking the Restored Smiles courses, I was able to provide more services to our patients and keep those services in office as opposed to referring them out. So that was a less of an obstacle for our patients to have to undertake for them to be able to get the services that they needed.
My name is Dr. Babak Aryanajad. I'm from San Diego, California. I started my implant journey about 10 years ago, taking several implant courses with very notable implant companies. It wasn't until I started with Restored Smiles and Dr. Huss that I really gained the confidence of placing dental implants and being able to help my patients as a whole with their dental health. My confidence in placing dental implants since taking the Restored Smiles implant course has skyrocketed. I've taken many implant courses, and the approach that Dr. Huss has with training really gives you basic fundamentals of dental implant placement and really allows you to gain the confidence to go out and do it yourself. What I value most about the program is the bond you build not only with Dr. Huss, but all of the other clinicians that are taking the course along with you. You can reach out and collaborate on a lot of the cases that you're working on and just get help, advice, feedback on what's going well and what's not going well and how you can learn from those mistakes. There was definitely individual mentorship with Dr. Huss. He is very approachable. I have him on a text thread, and I'm able to reach out to him at any point, and within minutes he responds to the questions that I have.
Hi, my name is Michelle. I'm based in Sacramento. Restored Smile program definitely boosts my confidence in treating patients, especially in implants placement. I have very minimal experience to begin with, and then I'm always shy away from planning implants or doing the implant treatment myself. But after joining this program, I'm definitely starting to placing implants in some case-selected cases. Yeah, my confidence boosts up so much, like from feeling comfortable in doing the treatment myself to right now. If there's any case that I feel comfortable doing, I will start doing it. For my program, I feel like I gain a lot of different experience. The experience I like the most is basically interacting with other dentists who are participating in the course. I was able to learn from their implants placement, and also I was able to discuss with them about my treatment and my my procedures as well. And that's the interaction. That part is the one that I value the most. Yeah. Throughout the program, I do have a lot of attention from my mentor, Dr. Huss. A lot of time when I have questions, I can go directly to him and ask for help. And then we will actually discuss, and then he'll walk me through the process. And I like how he actually helped me with my critical thinking. It's not just giving me an answer. We would actually talk about the process, and then so that in the future, when I have the same problem, I know how to troubleshoot for my cases.
My name is Varsha Ahuja. So it has brought a lot of ease in treatment planning implants in general. It was a big paradigm shift. It just opens up your eyes towards, a lot of other implant-related prosthesis. It builds your confidence, and it's just been a truly game-changing. It built my confidence with, so much hands-on training that we got in the course, and then so many discussions that we went through during the course, after the course as well. And he definitely emphasizes, he's very, very passionate about implant dentistry, and then it resonates with you. He truly believes in what he does. And so, you take that home with you, you start practicing that, and then, he just definitely wants you to just make sure that, you're not consumed by any kind of issues that you go through, and then you still start working on it again. I truly value all the information, the education that I gathered during the program, and again, even after. I value the relationship that I built with Dr. Huss, and my peers in the program, and I met my co-owner in that program as well, and I value the confidence that I got in placing implants and also learning about the restoration part of the implants. There was a lot of individual attention. I definitely, got a lot of tough cases, and the fact that he made it so easy to learn through those hardships, but there was a lot of attention that was given to you. You're never alone, you're never alone during the program. It's amazing. I would recommend the course to the Restored Smile course to any dentist out there who wants to learn about implants and wants to start placing implants right away. It's definitely one of the best additions to your dental practice.
Yeah, my name is Matt Lott, and I'm based out of Nashville, Tennessee. Participating in the Restored Smiles definitely gave me the confidence to place implants, something I didn't get a lot of exposure to in dental school, and it seems kind of daunting to go out, learn to place implants on your own. So not only did I get good direct guidance, but also after the course I felt totally confident and comfortable to place them on patients by myself. Yeah, my confidence has changed not only for myself, right? Confidence in case selection, confidence with the procedure itself, confidence with the post-operative complications that can arise, but also I've helped transfer that confidence to my associate now and help teach him a lot of the things that I was able to achieve through the Restored Smiles program. I really valued the fact that he taught you without being too hands-on. He lets you make those mistakes, but also he was there to help you when you got in a bind. And right, you learn more from the hard cases or from the mistakes that I made than I did from the really easy, successful cases. Yeah, I felt like I had a lot of individual attention. He was a great mentor, like I said. He was there, he was always available for you, but he also let you learn without hovering over your shoulder, right? He let the group work together. You're with another great group of docs, all in it together, and he just kind of helps guide and facilitate as you go, and lets you make those mistakes, right? Helps you recover when you mess up. And then the patient outcome was all really solid too as a result.
My name is Dr. Tran. I'm based out of San Marcos, California. Implants have always been a part of my practice already. I've already been placing them before the course, but after I took the course, I've been able to take on larger cases, better at diagnosing, even referring to the specialist as well for those that I don't want to do. So it really has allowed me to have a broader scope of knowledge for my patients, and I just a higher level of confidence. Before I started the course, I thought I was pretty confident, but now it's a whole nother level of confidence when it comes to implants. Everything from speaking to patients about implants to actually clinically doing it, and also now coaching other doctors about talking to patients about implants and doing them too. One of the most valuable experiences that I took away from the course was not only having additional confidence, but being able to provide a better and higher level of care to my patients as well. I would say that's definitely the best part about the course, is just being better able to take care of my patients. In terms of how much individual time I had with the course, it's a small group setting. I think there was 8 or 10 students there, but Dr. Huss is really good about providing individual one-on-one care depending on whether or not someone needed more attention or less attention. He was just really good at providing that guidance to everyone. Mm-hmm.
My name is Nicole Smith. I am a general dentist and implantologist, thanks to Dr. Huss. So before Restored Smiles, I actually took 4 implant placement courses and had only placed 2 implants after that. Since taking Restored Smiles, I've placed dozens of implants in my practice. So it's transformed my practice completely, because now I'm not referring all my implants out to my specialists, but I am doing slam dunk implants in less than an hour myself, which is super exciting. So working in the course with Restored Smiles has been game-changing for a few reasons. One is that I'm working side by colleagues with me who are helping me, pushing me, assisting me, telling me when I'm supposed to be doing something different, directing me, and it's never embarrassing. They're there to help us. But mostly the Restored Smiles course has been different for me because it's hands-on with my colleagues, whereas most of my other courses, I was only placing 1 or 2 implants, possibly on a live patient, but mostly in pig jaws or plastic typodonts. What I value the most from the Restored Smiles courses was definitely the camaraderie, and one of the coolest things was that there were a lot of things that went wrong during surgeries, which can happen in real life, and everyone was there to see like, okay, so now we're problem solving. What can we do to really make this still a successful implant surgery? Or maybe not. Maybe we're taking the implant out and re-grafting, and let's game plan together with all our colleagues and with Dr. Huss there by our side right next to us to tell us, okay, this is what happens in real life. This isn't a typodont. You can't just slam dunk place the implant. Things go wrong. So now let's figure it out together, talk about it, and we problem solve together. So that's been the biggest difference there. Oh my gosh, did I have enough individual attention? Dr. Huss is probably the best teacher I've ever had in any kind of courses, and I have over like 1,000 hours of CE courses done. He's so awesome just being like right there in it with you. He knows everyone by first name. The text messages, that he sends to our group, everybody after the course, when we're doing implants, we're sending pictures of it. He's posting it on his own Instagram, like reposting our work. It's so cool. He's truly a mentor and a friend, and that's really incredible. I appreciate that so much.
My name is Kenny Leong. I'm a dentist. I work out in Victorville, California. Restored Smiles was basically my first introduction into implants. There's a lot of implant classes out there, and I've taken a couple before, and probably the biggest complaint I used to have was that even after I took the classes, it was just hard to actually implement, take away that stuff, and take it back to my practice and put it into use in my day-to-day. But with the Restored Smiles courses and with Dr. Huss, that was the first time that literally from right after the classes, I was able to take what I learned and actually have the confidence to implement it in my day-to-day. That makes all the difference in the world, makes it well worth the time and the investment. Program basically gave me that needed confidence to be like, hey, I'll be okay doing this on my own. When we were taking the live hands-on portions, and we've got a whole classroom full of docs, sitting chairside with you, assisting you, and being able to, walk you through the process, someone to stay with you side by side. That gives me all the confidence to basically be able to do that same thing, back at your own practice, back at home. Probably what I valued the most, or what I found the most valuable, was that, overall, all of the courses were taught in a way that was easy to understand. It made it in a really fun environment to learn too. Dr. Huss also created like a good camaraderie amongst the group of us that were basically taking the course together. So not only did it provide good educational content, but it basically provided resources and a whole group of people to be able to turn to even after the courses ended. So once you run into some problems back at home, back at your home practice, there's a group of people that you can reach out to, resources that you can lean on, basically, to still be able to implement what we learned. Dr. Huss definitely was able to give us a lot of individual attention, one-on-one. He was roaming room to room, basically would be there to sit chairside if we really needed to, but he stayed also on the sidelines. It gives us room to grow on our own and to try things on our own. But I always felt that, if really need be, he was standing right there at that doorway. So I would definitely recommend the program to any dentist out there who is looking and has been looking to get started with implants, but just couldn't get that proper push to get started with things. So anyone who's maybe even taken some courses before in the past but hasn't been able to actually implement it in their home practice, this would be the course for you. I really do think that it's one of the few courses out there that will give you that confidence and the know-how to take that next step.
My name is Dr. Clint Walker. I'm in Costa Mesa, California. It's changed a lot. I've really been able to help my patients fully. So it used to be that I'd have my oral surgeon do the extraction, my periodontist do the implant, and then I'd get a chance to restore it. Scheduling with my specialist was more difficult. Time's really important to my patients. So the idea that we can do a Monday through Friday, schedule them, get the implant placed together, and then go ahead and restore it 4 months later. So it's something that's just been really nice that I can be more hands-on with my patients and just be able to offer the treatments that I want to offer with them. I've taken other implant courses in the past, and it's been exciting. They were considered hands-on because they had models, and that was a nice start. But actually placing implants into bone and doing the open flap and actually be able to see what you're actually putting into was really helpful. So Dr. Huss was fantastic at making sure everyone's confident. But more than that, what I thought I never would use was the text chat, or the text group text that we did. I'm not really a texter. I'm not on Instagram or anything like that. So the fact that I had a group of people who we've done these with, I could send them to my successes, my failures, and they'd be able to kind of tell us, hey, I would try it this way, or good job, that looks great. It was just something nice to know that I wasn't the only one who liked it. I think it's the community. So Dr. Huss has seen a lot of doctors and really trained them how to do it. And that was something that I didn't realize how much I wanted to have another person's opinion or trying to treatment plan for something. I have a CT in my office, which is what I was waiting for before I did my implant. Like, I actually started placing them. I've taken other courses, but the integration of him showing us how to use the DTX Studio to place the implant before, and then actually looking at the before, like the planned model to the actual final, it's really nice to know if you nail it, you don't have to do guided, you can make sure that you had a plan before and you're just executing the plan. I have texted the group chat, but I've also worked, I had a failure from a different periodontist before. I talked to Dr. Huss, he really kind of guided me through it. It just gave me the nudge of confidence I needed to kind of work forward. But during the class, you don't really know what you're doing. You're trying to figure it out. You've done it. You've done the models. I mean, I struggle with sutures. It's something that I remember I graduated from dental school and I knew how to suture, but I never practiced it. So I went and actually bought the pad that he recommended during the course. And so I just practiced and I tried to make sure I knew how to do the mattress and knew how to do all the different kind of sutures necessary. So I do think my skills have got better, but if you don't work at something, you're not gonna get better. And so the pushing and just the kind of making sure that being our best selves is important.
My name is Shahab Aryanajad in San Diego, California, and I've been practicing dentistry for about 13 years. The way Restored Smiles has changed the way I practice dentistry is, mainly in my surgery career. I've become more confident in extractions, managing tissues, obviously placing implants, being more confident in overall patient care. Just knowing more about how to prepare for surgeries, complications of surgeries, mainly with implants or extractions. So my confidence has changed tremendously. I'm able to better support my associates in techniques of grafting, socket preservation, placing implants. So it's really helped me kind of utilize better techniques and helping support my associates in the practice. Restored Smiles programs taught me a lot about collaboration with other dentists. And the thing I value the most is how important it is to provide best care for our patients, and being able to extend my career with better knowledge of implants and the latest and greatest techniques. The more knowledgeable you are about procedures, which Restored Smiles has helped me gain, the better you are prepared to handle those complications and things that can go wrong during surgeries, extractions, or implants.
Hi, my name is Dr. Aja Thompson, and I live in Missouri City, Texas. So Restored Smiles has really impacted the way I practice dentistry because implants are the standard of care. And to be able to offer that to my patient instead of having to refer them out to a specialist, I now feel a lot more comfortable being able to do my own implants, extractions, placing them, and restoring them due to the class. So Restored Smiles program changed my confidence. One particular way was just extractions and suturing. I like to do extractions, however, the suturing part just would take me forever. And we really went over the different techniques and different ways we could suture. And now I have associates who do extractions. I'm like, hey, can I jump in and suture for you? So that's really helped me a lot. There's a couple of valuable things I picked up from the program. Number one, the group of people that I did the program with. You kind of create your own bond with them, and we lean on each other when we have questions. We still are in contact with each other and send each other messages if we need help with something or if you need a suggestion. And then also just, I'm now able to place implants. And that has helped, my practice grow. It's also helped with just access to care for the patients. So there's a lot of individual attention that Dr. Hess and Jesus offer. The team was amazing. You always had somebody there, from start to finish, helping you map out where you want to put the implants, which implants to choose. And if you got stuck, Dr. Hess was able to jump in. And even after the program, we're on group message. And if I need him, I know I can text him and he'll respond and help me out. So I would recommend that everybody does this program. We're all capable of doing implants. And if you get the right teacher and the right course where you are really doing implants. So, it wasn't just a didactical course where you're somebody sitting and talking to you and showing you stuff on the screen. It is hands-on. So I'd recommend this for everybody. Thank you, Dr. Hess. I appreciate you taking the time out, coming up with this program. It really has helped my practice and helped me grow as a clinician.
My name is Tyler Orn, and I'm from Conroe, Texas. So it has changed the way that I do dentistry in the fact that I'm, allowed to give patients a good option after we remove teeth, right? Being able to place an implant and, restore confidence, restore function, restore a smile, okay, is life-changing for a lot of patients. And having that ability has dramatically increased, case acceptance, right? And just the ability to help patients overall. So my confidence has changed dramatically since taking the program in that, a lot of different courses, when you place implants, you don't come out of them with that confidence. But even after just the initial implant, sorry, I'm screwing this up. So even after just the first case, just the way that Dr. Huss communicates with you, assists you throughout the case, it just shows you that he's always there. And you will have complications. You want to have those complications with those patients in the course. You don't want to have those when you're by yourself in your own practice, right? And so he allows you to problem solve yourself and help you what's the word I'm looking for? Helps you correct any mistakes that you've made, or if you develop a problem, how to address it with confidence, without the patient becoming alarmed or anything like that. In handling the situation, there's a lot of circumstances where he's able to do that, which is great. What do I value most from the experience? So for me, I think I've always wanted to place implants and give patients that option without referring out of the practice. So really just being confident in the ability to place implants every day. Extracting a tooth, being able to give them that replacement option. That's one of the greatest takeaways for me. So I definitely had a lot of attention throughout the program and afterwards. Dr. Huss is always there for you.
So my name is Arash Ali. I'm a dentist in Los Angeles, California. The best way I can say it, I was telling one of the friends, is that I think it overall made me a whole dentist, practically bringing everything together. So it's been an amazing ride. The whole class, all the information, camaraderie with other people in the class has helped me grow as more of a general dentist, but not solely doing crown, bridge, doing everything. Doing the implant is growing every day, but the confidence as an overall general dentist, a lot better. Knowing the knowledge and being with the patient and coming with the total treatment plan by yourself, not thinking, okay, I gotta get the consult with perio, now I gotta get a consult with OS. Now I know more what to do A to Z. Growing to a next level of being a dentist, that has been the best advantage I can say. I learned the new ways of doing stuff, placing the actual implant, but overall being a better clinician and comprehensive dentistry for my patients.
My name is Pratik. I am from Northern California in Lodi. It has been life-changing. I was always wanting to do implants and implement that into my practice, and by taking the course with Dr. Huss, it has taught me a lot, gave me the confidence to do the implants, diagnose it right, and also convert them into treatments that I can perform, and boosted my confidence quite a bit. Just by learning the clear guidelines of doing the implants, case selection, what makes the placement of the implant successful long term, and doing it with such clarity that your failure is going to be very minimal. That definitely gives you a lot of confidence into placing it more and more, and keep repeating the same results and getting the success out of it. Most valuable thing I would have to say is getting the guidance from Dr. Huss as a mentor, and he is always very reachable person. He makes learning a lot fun, and he's always there. Like anytime I have a complex case, I have any questions, I'm able to reach to him. He is a text away and usually responds within like few minutes most times, and having that constant guidance even after the course is over. Last time I did course with him was over a year ago, and I'm still in constant touch with him, share cases, get some guidance, and you cannot put value on that. Do it. I would say if you are on a fence, thinking about which course to take or whether to take it or not, if you think that implant is something you want to do in your practice, do it. Do the course. It is amazing, especially not only for the beginners, even for when I was doing my course, we had some veterans who had placed like maybe 200, 300 implants, and they also end up learning a lot more from Dr. Huss's personal experience, because he's been doing it for a long time, and he's a great educator and communicator.
So my name is Tasneem Arsiwala, and I'm based out of Houston, Texas. So it was done in a very comfortable peer-to-peer setting, and that has really changed my dentistry to the point where I feel very comfortable placing implants, and not only just restoring teeth, but also the patient as a whole. My confidence has vastly improved. I feel more confident doing surgical procedures, bone grafting, extractions, and just dealing with the tissue and as such. I value the building of confidence for sure in the program. I value the chance to learn and do more. It has opened my eyes to an entire different aspect of dentistry that I knew existed. I just wasn't confident enough to do before. So I really appreciate that aspect of it. So for sure, the program is very well run by Dr. Huss. He takes mentorship to a different level. It was not only like before or during the program, but even after, we followed up like through text messaging. He's always there to answer any questions. I remember texting him about a patient with an x-ray, and he responded at once with that too. So I love having that mentorship as well.
My name is Tanisha Jackson, Redlands, California. Restored Smiles has actually changed the way that I practice completely. I've practiced for almost 25 years, and when I took the class, I was doing implants here and there, and I wasn't very confident about it. But when I took the class, Dr. Huss actually taught in such a way that I chose my cases more confidently. I was able to treat them more confidently, and if I ran into any complications during the surgery, I knew how to handle it. So that changed everything about the way that I practiced in my practice. I would say that taking the implant course with Restored Smiles has made me more confident by not being afraid of failure. I always figured I would have cases where I went to do an implant and I would run into something I wasn't familiar with and not know how to handle it. So now I speak more confidently to my patients about implants, and I'm much more confident that I can actually deliver what I have promised to the patient. The most valuable thing that I've gotten from the program is just the complete understanding of how to do implants, how to do good case assessment and case selection. I also have the ability to kind of know where my parameters are as far as surgical parameters are, and know when I should refer out versus when I should actually do the treatment myself. And quite honestly, I can do most treatment myself. And I wouldn't have been able to say that a decade or two ago. I felt like I had a lot of personal instruction from Dr. Huss. He provided a lot of, one-on-one, side-by-side coaching. Even though there were, probably like 10 of us in the class, he literally was by our side doing implants at least, 4 times, each weekend. So, and with us actually assisting the other doctors, it was really helpful to get that knowledge as well, because you're not just learning from the cases that you're doing, you're learning from the cases that your partner or the other person that you are assisting is doing. And if you ran into something that looked unfamiliar, Dr. Huss was very proactive. So Dr. Huss was very proactive about coming over and guiding you through the treatment, and also had you do the treatment instead of taking over himself, which was really nice. If somebody was thinking about whether or not they should take the course with Restored Smiles and Dr. Huss, I would say definitely do it. I wish I had taken the course many, many years ago. I had been practicing probably 20 years or so before I actually did the class. And had I had the knowledge that he gave me all those years, I would definitely be in a different place right now than I am now.
Okay, my name is Romulo Galicton, in Chico, California. Working with Restored Smiles with Dr. Huss specifically improved my confidence. He's a good teacher. He's down to earth. I mean, I say that, with my age, this is not my first time. I've been through, this is the third. So when I say he does his job well, he does his job well. Through the course, not only did it change confidence, but it actually, not just changed it, it actually made sure it boosts everything up. Not just implant placement, restorative, and other stuff, communication. It's not just about implants, it's about communicating with your patients. And that's what, and being, comfortable with your skin. The program actually, as I've said, it actually would help you with your skills and then new stuff, different outlook, and different ways of doing it, because it's not just one way. Each and every director, clinical director, teacher, all different. And you can get a lot from him, from Dr. Huss and his program. Attention-wise, individual, oh yeah, he makes sure that he does give you all the time, sometimes too much, but yes, it's a lot of time that he gives you. There's no skimp on that. So it's not as if, oh, go ahead, do it. No, he'll make sure that he'll be with you every step of the way. So there's no worries.
So my name is Samita Sandhu, Northern California. The Restored Smiles program has changed the way that I practice dentistry by giving me the confidence to place implants. One of the biggest things with the hands-on course was getting one-on-one instruction from not only Dr. Huss, but my peers, which really basically just, gave me the confidence to place implants. And I think that that was probably one of my favorite parts about doing it. Doing the course changed my confidence. I don't really know how to say how. I guess just by having him as a mentor, so when things have gone wrong, being able to have, so one of the best things was the continuation of mentorship even after the course. being able to text Dr. Huss and just follow up with him when things are not going right really helped me to implement changes in my practice. I value the most the hands-on learning, and definitely having the ability to, like I was saying earlier, to work with others. And I feel like having the small groups was really beneficial. Yes, so during the program I did have a lot of individualized attention from Dr. Huss, and he was able to basically, when anything was not going right or I needed an extra push, he was there for me. There was one particular part where I was just getting really nervous and I was like, I don't think I can do this. And having him there was really awesome. So he's such a great person and has such a he brings so much energy to the course that there's nothing else like it. I'd recommend this course to anyone who wants to get a great basic knowledge on placing implants, to anyone who wants to take their dentistry to the next step, and even people who aren't necessarily going to maybe place the implants, or if they just want to learn the restorative aspect of things too. So obviously you're taking it to get the confidence to place the implants, but it is a nice way to, after the course I had a lot better understanding of the steps involved with taking all the different aspects and steps of implants themselves. So it was really great just from a restorative perspective too. This is good for beginners and people who have been doing this for a long time. There's definitely something to learn for everyone.
Hi, my name is Igu Zhao in San Diego, California. The Restored Smiles program changed the way that I practice dentistry because it's really instilled a lot of confidence in my surgical skills, and I'm able to offer a wider range of services for my patients, like placing implants and doing more extractions and socket preservation, and I actually really enjoy it, and it's something that I didn't know or have the confidence to do until Dr. Huss came and taught us. So the program has really, there's the hands-on aspect of it and working side by side with Dr. Huss, having him not only show us but guide us the procedure step by step has really just boosted my confidence. It's made me realize that, wow, these are things that I can do and I'm not scared to do anymore, because we do get very limited exposure to that in school, and depending on what practice model you're in, you might not get as much hands-on experience. So yeah. What do I value the most? One of the things that I value the most is actually just the relationship that I've formed with Dr. Huss. He's super responsive and he really is a great mentor. So even on days when I'm having a hard case, I know that I can shoot over a text to him or Jesus and they would be able to kind of help me on the spot. So I really love that about what's come out of the program. So I did get a lot of individual mentoring during and after the program. Dr. Huss is so great about going around and checking up and, and always checking in. We have a group text that, we've created where we can share our cases. So there's definitely a really great sense of camaraderie and, and just support. So I love that. I would recommend this program to really anyone. You can be a new grad out of school that just wants to, get more into surgery, or you can be a dentist that's been practicing for 10, 15 years and you just feel like you want to add that surgical aspect to your practice, or you might be practicing somewhere where you don't get to do as much extractions and you feel like maybe you've lost your skills a little bit and you need that little confidence boost. It's really appropriate for any dentist, no matter the experience level.
My name is Dr. Marcos Magar. I'm based out of Huntington Beach, California. Restored Smiles have actually increased my productivity significantly by giving me more confidence on how I do implant dentistry, let alone other types of dentistry that helps restoring different parts of the mouth. My confidence has changed in such a way where I'm more willing to tackle on more complex cases that are a little bit outside of my comfort zone. It's allowed me to do a lot more dentistry for a lot more people, and that's only allowed more patients to come through due to word of mouth referrals. The biggest thing I value the most is Dr. Huss's candor, the way he's willing to give us the confidence to speak our minds and ask the questions that may seem a little frivolous, but at the same time allows us to feel that we can actually engage in what we need to do to be able to accomplish what we should. I definitely felt that I had a lot of engagement with Dr. Huss before and after. He has his personal touch to everything and makes you feel like you can come to him as needed and that he's willing to help any way he can. I definitely would recommend this program to anyone interested in implant dentistry, no matter how novice or how experienced you are. You can always learn something new from Dr. Huss because he's willing to share his experiences and all his highlights, all his pitfalls, and how you can improve little by little.
So my name is Vince Knight. We're based out of Northern California in El Dorado Hills. Yeah, so Restored Smiles has helped transform my dentistry tremendously. I now find myself treatment planning implants more than I ever have, but it's more so because of how confident I am in placing implants. And it's also helped me also pick out cases that I know that I shouldn't be doing, which is equally as important. So my confidence from Restored Smiles has changed quite a bit in the sense that I feel that I'm doing better treatment for my patients of all ages too. It's improved my confidence as well in terms of working with my oral surgeons and periodontists, better treatment plans for my patients. And at the end of the day, I feel like I said before that the patients are getting better treatment, better quality of treatment. So the most valuable thing I've gotten from the program is not just the ability to place implants predictably and efficiently, but also to be able to mentor that to other associates that come into my office and be able to confidently talk about surgeries rather than referring them to a surgeon or another doctor. They can learn these techniques and watch me in the office. Yes, so during the program, Dr. Huss, yes, he gives a lot of one-on-one. I'm not the type of student to ask a lot of questions. I want to be very independent. But Dr. Huss, what I did really like about him was he would make sure that I was still doing things as they should be done. And he's very straightforward. If you're not doing things, he's gonna let you know, but he has a very good delivery. It's not the softest delivery, but it's in a way that you feel inspired to not do that again, and you feel like you are actually getting constructive feedback. Oh, 100%. I'd recommend the program.
So my name is Paul Wad. I am based out of Pomona, California. So working with the Restored Smile program, it allowed me to tap into the skills that I knew I had from before, but with the confidence to take it to the next level. I went from knowing I can do something to doing it confidently, repeatedly, and not shying away from new challenges. Implants being the main focus, of course, and I had placed implants before. I had done a GPR. I had a lot of experience, especially compared to dentists coming out of school, yet it still was an incredible experience to take this class and to know that there is another level that I can go to, and it took all my skills to that next level. So the program changed my confidence by just showing me that there's more to dentistry. I had been a dentist for 15 years, and when I took this class, I had felt like I was reaching a plateau, and the course showed me that there is more to dentistry, that there aren't just things that specialists only can do, and that as a general dentist, I can also go to another level to experience more of what dentistry has to offer. And it gave me this whole new perspective that made me fall in love with dentistry and fall in love with patient care and fall in love with surgery and just be a better dentist overall. So what I value most with my experience from the program is getting this sense that there's more to dentistry than what I was settling for. I had fallen into maybe a routine and I was good at what I did. Just like most dentists, they get to a certain point and they are great at what they do. And the program showed me that there's, again, another place you can take your skills to hone your skills, to increase your capabilities, and to be better at everything, and also add on this new skill of placing implants, dealing with patients, and just doing more for your patients at a better way and a better process. During the program, I definitely felt like I was getting quite a bit of individual program help. Definitely felt like it was a great team. It wasn't just me learning on my own. It was me and people who I would actually call my colleagues and friends, and we were all learning together and getting better together. We learned from each other, with each other, and most importantly, it was Dr. Huss's personality that made it not just a learning experience, but a fun experience, an experience that I wanted to take back to my office, that I was excited about. I think it's his energy that actually sold me on doing this in my office all the time, and taking that excitement back to my class when I was able to do it.
All right, my name is Dr. Andrew McKell. So the course has given me so much confidence. Working with Dr. Huss and going through all the complications and such has helped me honestly place more implants individually and have a set structure for my office and my team to provide more care for my patients. I think it changed my confidence because it was very, very hands-on. I value most from the program is having a network of dentists who have the drive of placing implants, and we communicate together and try to better our patients. Yeah, Dr. Huss definitely spent a lot of time with each person. He spent time with me going over each case, the CBCTs, to figure out exactly what we're doing, to game plan, so we are confident on 100% success rate.
Okay. Hi, my name is Dr. John Nosti, and I'm based out of San Diego. Well, the Restored Smiles dental program has been fantastic. Dr. Huss has incorporated a lot of great tools in his program for us to get better. And that is not only the academic side of it and the teaching, but then the lab side of it and being able to do the cases benchtop and then taking that to patients, which has made a huge difference because you know, a lot of the courses I've taken in the past, you would do one part of those, but they wouldn't put all the pieces together. So actually following through and being able to work on patients really puts all the pieces together and allows you to become proficient enough that you can take it back to the office and then work with patients immediately. So it's great. My confidence has changed significantly after the course because we were working on patients, and so it was no different than going to the office and working on patients, but the big difference is Dr. Huss is working over your shoulder, you're making real-time mistakes and working through those problems and those solutions with him. And so then when you go back to the office and you encounter those things again, you've already gone through it and you're not, you know, as worried about it. So it's a huge confidence builder in practice. So I value most from this program is the community and the quality of follow-up that Dr. Huss has with all of his clinicians. You know, if you have questions afterward, you can text him. He gets back to you very, very quickly. Most of the docs that I was in class with, we still communicate about our cases and our successes, our failures, and so you have a sounding board after the course to be able to work through problems and get more proficient with every case. The course is great because you get a lot of individual attention. You know, Dr. Huss has set up these courses so that there's a small class size, so everybody knows everybody's name. You're working on other people's cases with them and watching them go through the learning experience, and then you're going through that same learning experience. So it's not like you're just doing it once, you're doing it multiple times, and you're doing it in an environment where you know everybody by their first name. It's great.
I'm Dr. Feely. I have an office in Nashville, Tennessee. So after taking the Restored Smiles course, I felt very skilled and able to place implants by myself, and not only place them, but if we had any problems, I was able to kind of assess the issue and confidently treat it. So it's one thing to place an implant, but if you have something go wrong, which hopefully it doesn't happen, Dr. Huss really helped teach us what to do, how to do it, how to stay cool, calm, and collected during that as well. After taking the program, I definitely felt more confident placing implants on my own. I had been trained to place implants before in residency and in school, but definitely I didn't feel like I was able to do that. And really, if something had happened, I didn't feel as confident that I'd know what the next step would be. After taking the Restored Smiles course, I definitely felt more confident in being able to diagnose and treat and kind of restore people's smiles, you know, give them one tooth back at a time. After my experience with the program, I think what I valued most was really obviously the knowledge that you got from it. It was pretty invaluable. What we got out of it was a lifetime of knowledge and ability and skill. You get to work with not only Dr. Huss, but with Jesus, and you get to work with all these other dentists who are learning at the same time you are. So you get experiences and knowledge that you wouldn't have had before. During and after the course, not only Dr. Huss, but Jesus are really good at reaching out. They want to know if you're placing implants, if you're having problems placing implants. They want to know your success. They want to know if you're having any issues, and they have been there individually. They've been there with a group, so if you don't want to be too individualized. Since the course, I've been placing implants at a much higher rate than I was before. And I know I have Dr. Huss too there if something happens, or I even recently just had an issue with an implant that another provider had placed, and I really wanted feedback from Dr. Huss. I showed him, and he really gave me that one-on-one that you can't get kind of without that mentorship and guidance.
My name is Simran Gill. I have a practice in Vacaville, California. I think Restored Smiles has boosted my confidence in looking at dentistry in a different perspective. Before having the course with Restored Smiles, I was not diagnosing, treatment planning a lot of implants, but after the course, that changed my outlook completely. Now I see these missing teeth, the spaces in a different perspective, planning, restoring a lot of implants, and also doing implants as well. So there has been tremendous change the way I practice since I've done my course with the Restored Smiles. I would say my confidence has gone basically from 0 to 100, from not doing, restoring, or planning any implants to now looking at an implant as an option of replacement as the first and the best option we can do. So it's been great boost in confidence since I've done the course. And it's just not just me. I think overall my practice, my associates have gained a lot because I was able to relay the information, and they ended up doing courses with Restored Smiles too. So I think it has tremendously helped not just me, my practice as a whole. Dr. Huss's teaching style is very personal. It's like, you know, he wants to know where you at with your career, with your clinical skills, and he caters to that particular confidence level where you at in your career, and you know, it goes from there, okay? And not just that, even like once you're done with the course, he will check on you, and you know, is always available for the feedback if you have any questions. So I think that the personal touch is very important for me, and it's helped me a lot and boosting the confidence because I tend to not speak much when it comes to asking questions, but he's always like encouraging us to ask questions, checking on us individually, how we're doing when we were in the course, when we were doing the personal in-person courses as well, live surgeries. So that was a pretty important part of the course, that he had the personal touch and personal importance to each candidate that we were at our course. The course has made a significant monetary difference. As I mentioned earlier, we were not doing a lot of implants, so that comes to we're not restoring a lot of implants. We were referring out a lot of implants. Now we are keeping all those procedures in office. Like it does make a difference when you are done with the course and you're doing a lot of more implants, and it has a significant monetary difference since before I was introduced to the course. I would just say go for it, and you're not going to regret it. It's going to make a tremendous change in your clinical career and also as your business career if you are a practice owner. So not just that, you'll be able to serve your patients better. And as I said, it's like the personal touch with the course. It actually helps you to grow better, like get more out of the course from any other course, and that'll make you a better clinician. So I would not think about it, just go for it. And I'll highly, highly recommend Dr. Huss's Restored Smile course.
My name's Turner Reed. I'm a dentist out of Spring Hill, Tennessee, just south of Nashville. The Restored Smiles, they really were a big eye-opener and really helped me out with starting from not even knowing where I could place an implant and having bad referrals to knowing exactly what I can do and what can happen if I need help from other people to kind of put together a big cumulative treatment plan for these patients. My confidence, from before to after, it was completely just switched. I was super nervous going into it and almost didn't even show up and just wasted it. But really happy I showed up, and by the third course or third day of the course, I was already placing implants in the office, which made me feel more confident in myself, but also having the support of Dr. Huss to, if something were to go askew, I knew somebody had my back. I think my favorite experience was on the very last day of placing the implants. There's a little device that we screw into the implant, and it snapped off in the implant. I freaked out, but stayed calm in front of the patient. Dr. Huss came in and was just complimenting me the entire time, which I'm just like, what the heck? Just look at this implant, look at this implant. And he was able to get the little stud out. But that also came back to, him having my back and taking care of us. I think I value, expanding my knowledge and my field and what I can do to help out these patients. There's no more rewarding effect than giving back a patient if it's an overdenture or a single tooth. Patients just are so thankful, and it just makes it all worth it. Having the mentorship when he was there was very helpful because it's new and it's scary. But I know that if I were to call him up today or tomorrow, I know Dr. Huss would answer my phone call and definitely help me out.